Welcome to the Low Carb MD podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome back to the Low Carb MD podcast. Tro, this is going to be something. I think it's going to be mind-blowing for a lot of people. I know it will be for me. So we have a great guest today.
Absolutely. I'm really really pleased. I first heard this speaker on Zoe Harcomb's podcast, maybe it was a year ago, and I was blown away. I was completely blown away. It's exact. He put into words what I was thinking, and then I looked more into him, and it turns out he is a doctor in mathematics who's been looking at statistics, AI, risk assessment. He's a professor emeritus at Queen Mary University in London, and retired. But he has written over 400 peer-reviewed articles. He did his, bachelor's, master's, and PhD in mathematics at Sheffield University, and he is the author of a book, which I think you can see there, "Fighting Goliath," I believe is the title, right?
Yep.
Yeah,
Yep.
absolutely. And we'll put those in the show notes. Professor.
Fighting Goliath. Yeah, that's the
Yeah.
truth. Oh my goodness, that's what we're up
Yeah.
against.
Professor,
with a
we're so excited to have you.
Kennedy Jr. endorsement on the front cover there. So
It's amazing. So maybe where we could start, Professor, is just a little bit about where you're a numbers guy. You're clearly, right. You're looking into the data in a way that probably most of our listeners may not completely understand. I want to start maybe with COVID. Certainly, we could tackle climate or nutrition, whatever you'd like. But what is the problem with our government bodies or medical organizations as they interpret data? Can you help us understand the main problem? Because a lot of us docs, I know Brian feels the same way. We looked at the public health response and we were scratching our heads saying the data and the response are not in line. So am I misinterpreting things, or tell me more about this?
well, there was never any justification for the lockdowns in the first place, and then the whole COVID hysteria was based on massively exaggerated case and mortality numbers, which were created by a combination of flawed definitions, which I can talk about, easily manipulated data, and inaccurate mass testing of healthy people. So, for example, in terms of the definition, so anybody dying within 28 days of a positive PCR test was classified as a COVID death, and that was more or less universal. Some places it was even longer periods. In some countries it was a bit smaller, but that was the UK. I think in some states in the US it was even a longer period. But for example, we know from freedom of information requests that less than 5% of those who were classified as COVID deaths, because of that, the way they would define it, actually really died from COVID. These were people, 95% had multiple existing comorbidities. And in fact, we know, for example, I'll just give you a relatively recent example. Freedom of Information Quest for Northern Ireland, right, which has got, 2 or 3 million people. Not a single person under the age of 20 in the entire 4-year period. So this is from February 2020 until the end of, in fact, till February 2024, which was the, sort of the official end of COVID. There were just 275 deaths which could be attributed genuinely to COVID in those 4 years. The youngest person to die from COVID or even COVID with pneumonia without other major causes was 38 years old. So the problem is that it was not a pandemic in the sense that pandemics were previously assumed to be understood, but these definitions also led to the belief that the only way out of the pandemic and lockdowns was by almost mandatory injection by, the novel vaccine, which had really been not subject, which we know had been subject to no real safety testing. And it certainly couldn't be proved to be either safe or effective. So these are the problems
about this.
And just to give another example of the manipulation, the easy manipulation of the data. So after the first lockdown in UK, that ended in the late summer of 2020. What happened was that lockdown ends, so people are now going to go back to work, go to school, college, etc. At that point, the government decided to introduce effectively mass mandatory testing, PCR testing, of anybody who was going to go back to work or school. So you had to provide evidence that you were not PCR positive. And many people had to be tested every day, and those who weren't still had to be tested regularly. I mean, school kids in the UK had to prove every day that they weren't, they had to go at least a lateral flow test, if not a PCR test. So what you had in that situation was this unbelievable ramp up in the number of people being tested, massively exponential increase in number of people tested, starting from the late summer, going into the autumn and then winter of 2020. And what you were seeing, of course, was an equivalent increase in the number of PCR positives. If you test more people, you're going to find more people testing positive. And of course, what was never really taken into account was the genuine false positive rate of these tests. So just to give you, let's just take a really extreme example. Let's just say actually in the summer of 2020, there was effectively no COVID going around in the UK. Well, let's suppose the accuracy of suppose that a PCR test has what's called a 1% false positive rate, meaning that 1 in 100 people who don't have COVID will nevertheless test positive. So 99% of people who don't have COVID will correctly test negative, but 1% will test positive. And let's suppose the test is perfect. It will always test positive for those who've got COVID, right? But there's that. What's the significance of that 1%? Well, it means if you test 1,000 people, 10 are going to test positive, even though there's no COVID around. If you test, and so obviously, the more people you test, the more people you're going to find positive, even though there's no COVID around. Now, what people don't understand, people will say, yeah, but if there is COVID around, then it's still going to be pretty accurate in picking up those. Well, no, it isn't. I mean, one of the beauties of Bayes' theorem, which is one of my specialist areas, was to show actually, even if that false positive rate is very low, even when there is COVID around, if it, for example, is only 1 in 1,000, let's suppose 1 in 1,000 people genuinely have COVID. Well, if you've still got that 1% false positive rate, it still means that of every 10 people who test positive, only about 1 will actually have COVID. So it means that most people who are testing positive do not have COVID. I mean, and all this was even without even taking account of the other known errors with the PCR testing. For example, we revealed it at the time, and there's details of this in the book, how for a very long period in the UK, all of the major testing units were reporting positive cases on on a single gene, whereas the manufacturer guidelines was that it had to be at least 2 genes. So even by the very definition of what should have been PCR positive, they were defying that. And it turned out that 30% of those positives, and a lot of those, again, even those are false positives, but even if they weren't, 30% of them were by definition not positive according to the manufacturer's guidelines. You had all of this stuff going on. And what was happening, this is the simple manipulation. All the government was reporting was this exponential increase in the number of positive cases, and it created this hysteria, this mass hysteria, that there needed to be another lockdown at the beginning of the winter of 2020. Now, all they had to do was just divide the number of cases, according to that definition, by the number of tests, and you would have seen there was no exponential increase. There was no increase at all. In fact, on all other measures that we had, for example, 999 calls, ambulance calls, anything like that, actual genuine triage information about people who had genuine symptoms of COVID, you find that there was no increase throughout that. There was nothing that was going on then, nothing out there unusual beyond the normal kind of like seasonal flu levels. And yet, why did they do this? They did it to create that narrative that we're going to have a second lockdown now. And they did have a second lockdown, major lockdown. And the only way out of this now is the vaccine. And that's how they created that narrative.
Yeah, no, Tro wants to jump in too. I have to too. Go ahead, Tro. We're probably thinking the same thing.
I think it makes matters worse, and I haven't seen this discussed in length, but I worked inpatient during the early pandemic, and I remember case after case, and I would ask my colleagues, a case would come in with patchy sort of consolidations on an X-ray, and that was COVID positive. And literally 3 months prior to that, they would get 2 antibiotics and a slew of tests. And then when they came in with this COVID positive test, it got switched. Antibiotics was dropped. It was
absolutely.
It was remdesivir and whatever else. And then they ended up on a ventilator. And I would say to them, like, this person's going to the ICU on a ventilator. Well, it's COVID pneumonia. I said, well, how do you know it's just not pneumonia?
Exactly. Yeah.
Well, that's the other problem.
People died because we didn't treat how we treated previously for pneumonia, which is typically 2 antibiotics.
Oh yeah.
And instead we gave them remdesivir and
intubation.
Yeah.
After renal failure,
so
30-some%.
Deaths that were there. What if it was just malpractice?
Even taking a step back. Even a step back on this, you say, well, cases going up. They would test the same person multiple times, and it would be like 50 cases of COVID with the same person. No one gets diagnosed with cancer multiple times, and we don't do MRI every day to keep. So it was all BS. And you look at that and you go, why would they do that? And then it's going to mess up the mortality rates because you have so many. It's the same person. They could only die once, so it's going to screw up the mortality rate. And then all the false positive rates that you say. And plus, I'll tell you, Doc, the other thing I saw was if my patient got admitted for a fall or a car accident, they would be tested at least once a day for COVID. And once they get that diagnosis, they're a COVID admission.
Oh, in the UK, if you entered hospital, irrespective of the reason, within 14 days of having tested positive, you were classified not as a COVID admission, and you were put in a special ward, right? Even if it was for cancer, broken leg, or whatever. And irrespective of what you entered for, as you say, they tested you as soon as you went in and then every day afterwards. And as soon as there was if there was a positive PCR test there, again, you were reclassified as a COVID case and not what you came in for. But are you aware, talking about what you said about the antibiotics, that's interesting, because are you aware that in the UK, there was the National Health Edict, it was actually guidelines were rewritten that COVID patients must not be given antibiotics. So anybody testing positive, they were actually refused antibiotics. Did you know that? It was in the NG13
Okay,
guidelines or something like that.
that's malpractice, in my opinion.
Yeah,
It's
and they
murder.
were given
It's
things like,
murder, man.
yeah, they were given midazolam, of course, which is again, will speed up death. I mean, this is what we call this in the book. This is the you ever heard of the iatrogenesis hypothesis? That if, essentially that the only major pandemic-like death peak, at least in most places, whether it was, I mean, you had those peaks, for example, in northern Italy, in New York, and in London, which were actually unlike anywhere else, almost anywhere else. That massive peak in March March through to very early April of 2020. It occurred in a small number of cities, and we believe that most of those deaths were actually caused by the response to the virus rather than the virus itself. It wasn't a natural peak. That's the iatrogenesis thesis, and it was, as we say, it's because of the inappropriate care of the patients. It wasn't just the unnecessary use of intubation, midazolam, denial of antibiotics. In the UK especially, it was because of the way they absolutely denied the elderly in care homes access to family support. Now, with someone my wife is in a care home now, which is something is also relevant to this discussion, but talk about that later. But I am more aware than most of what happens if you deny family access to elderly in care homes. They are going to die quickly in many cases because it's the family who basically keeps them alive in many cases.
Absolutely correct. I saw that in my own patients declining. And then, we would do a Zoom meeting and they would start crying because they never saw a person. They would knock on the door and say,
Yeah.
wait 30 seconds, pick up your lunch, go inside. And you isolate people. We know that increases mortality rate. Break from your faith, going to church, exercising, you're stressed out, everyone around you is a vector. So being in a chronic stress, that killed off a lot of people. So people weren't counting the cost of the lockdowns. They go, well, we just got to be safe and let's just close everyone's business. I saw the suicide, drug, alcohol, domestic abuse, everything went up. It's a disaster.
Instead, are you also aware this whole thing about, was it ever a pandemic or not? I mean, the interesting thing is that the week before the lockdown was actually March the 13th of 2020. In the UK, what's called the Advisory Committee on Dangerous Pathogens met, and this was March 13th. So this was like only about really 2 or 3 weeks into what was called assumed to be the COVID pandemic at the time. And they reached a unanimous decision that COVID should no longer be classified as a high consequence infectious disease because it was considered that it potentially was up until that point. Decision was made on the 13th of March 2020. And on the 19th of March 2020, the Public Health England website, and it's still up there to this day, believe it or not, actually states that as of 19th of March 2020, COVID-19 is no longer considered a high consequence infectious disease. What happened the next day, March the 20th? Boris Johnson announced the first lockdown. I mean, it's incredible.
So I wanna focus, let's, for example, tease out the politics of this, which the politics is politicians want power, right? That should be the assumption, right, for the most part.
Mm.
And I'd like to talk about the complicity of the scientific, academic, and physician communities. Now, shouldn't physicians around the world be like, wait a second, we need outcomes data for therapies. We need to demand that vaccines show hard outcomes. We need to demand that masks be used in a way that makes sense, right? That's been the evidence-based. where's the breakdown here in terms of looking at the evidence? Because there were complicit parties here,
Yep.
and I wish I could have been, I certainly was a contrarian during those times, and I wish I could have been more vocal, but how does this happen where we just accepted this? And I'm saying me and Brian didn't, you know, that was clear. But we, as in the 99% of doctors, the 90% of doctors who got 2 vaccines, the 90% of doctors who agreed with the lockdowns. How did we get here?
I mean, it's this herd mentality, especially amongst elitists, especially amongst professionals, people, uh, not just doctors, but in particular academics. It was bear in mind, of course, that much of the hysteria was created by these flawed statistical models from Imperial College with Neil Ferguson and the likes. People just accepted, oh, this is something so novel and so potentially terrible that we cannot take any risks here, and nobody was prepared to question it. But the lockdowns, the move towards the lockdowns as a solution, the initial solution, when of course they didn't yet have the vaccine, that was something that was being pushed by academics very much so. I mean, and of course Britain led the world here, unfortunately, in the stance. The Project Fear with these behavioral psychology people in the UK, and the need to create fear and how to create the fear, which led to people, as you say, like doctors making these decisions. That was being driven by not just far left academics, but Marxist academics. I mean, I know these people personally, and this is not, I can name a person here because it's on the record. I mean, the person who was heading this up in the UK, appointed by a supposedly conservative government, was Professor Susan Mickey, who's been a member of the UK Communist Party for many years. And to have someone like that make the decision, which was to move towards this incredibly authoritarian control. I mean, what do you expect if you give a communist the ability to basically control society? They're not going to, they're going to take up the mantle, aren't they? And that's what happened. And the thing is, it's this thing that right from the start, it was like, it's like it almost confirmed. I already knew that there was a problem in academia with the fact that the long march through the institutions, the cultural Marxist march through the institutions, had arrived at a situation where you had this groupthink, extreme left-wing groupthink, influencing the whole of academia. And given that it was the academics, and these are not, even remember, we're not talking about clinicians here. It was these academics, it was these modelers and these behavioral scientists who were telling us that this was terrible, this is how we're going to have to deal with it. These were academics, they weren't doctors. The doctors were the ones, as I said, the clinicians were the one who declared it wasn't a high consequence infectious disease on March the 13th. But it was the mathematical modelers and these behavioral scientists, all of whom are Marxists, who were pushing in this direction that we had to go. And they capitalized on what I consider they're opportunists. They capitalized.
I have to pause you here. There were countless physicians recommending the vaccine before it was even, but with a press release from Pfizer, before the data was there. We had academics, blindly following, this surgisphere data, that disappeared. We had, the physicians that were applauding the administration when they started to centralize the antibodies, and withhold them, from the population as the sort of the pandemic was rolling out. So I think that the physicians were just as complicit, if not maybe more complicit than academics.
Well, how about this with the Euro? I don't know if you're both aware, but the Euro surveillance when the PCR, like it was submitted in the next day, like December 21st and like 23rd. I may have the dates off by a day or two, but
Yeah. Yep.
there's
That's
no
right.
way you could peer review that. There's no way. And they had press releases the next morning. And when I saw that, I was like, I didn't sleep for 2 days because I'm like, holy cow, we're basing everything on this PCR would like, it's totally fraudulent. There's no way this could possibly happen like this. And there's no account for this.
It's not, and in our book, incidentally, there's an enormous amount of material about just how flawed and easily manipulated the PCR test was. And this was, as I said, this was the thing that was driving all of the flawed data and easily manipulated data.
How could it be that the flu disappeared? Like that year, my friend's
Oh,
an ER doc, he said, I saw 0 cases of the flu in a year. Zero, not one. He goes,
exactly.
we used to see 10,000 in
Because
that area.
we deal with that extensively in the book because effectively, all flu cases were being classified as COVID. COVID, the PCR test doesn't distinguish between COVID and flu. It never could.
Wow. Yeah.
People
So
weren't. They actually stopped all flu testing in the UK. All
it was
flu
really
testing
it
stopped.
was a perfect storm, really, right? Of greed, money. Because trust me, I was talking to one of my patients. He said his brother was fine. He was there talking to him. He said, this COVID's really serious. Within an hour of him leaving, his brother's intubated. The next morning, extubated. You go, what? Because then you realize, oh, they're getting paid like whatever, 20% more on the whole hospital bill if they get intubated. So it intubated temporarily and then you recovered overnight. Bro, have you ever seen that?
It's
It's
unbelievable.
insane.
I
I
think
mean,
there
this
was a
thing
lot.
about that again, what gets me is that it kind of like confirmed that classic to me, from my position at the time, I was within academia. Of course, I was effectively forced out because of the reactions against me, basically calling out the lies and manipulation of the official narrative. It confirmed to me that classical liberalism, which people assume to be a core component of academia, was effectively dead because it was actually academics and the left in general who completely ditched their supposedly traditional values of free speech, defense of civil liberties, and bodily autonomy. They just trashed all that because they were basically saw this as an opportunity for sort of a new world order of globalist authoritarianism. And in fact, leftist progressives who claim to be the fiercest defenders of, for example, civil liberty, free speech, and all of that, they were the ones demanding, the harshest, longest lockdowns. And again, free speech, God, they were the ones who instigated the harshest censorship. And they were the ones also, and the ones who claimed to be the fiercest defenders of bodily autonomy were the ones demanding people who were no risk from COVID had to be injected with this vaccine. And
Yeah.
and
The whole thing, I mean, those of us who practice medicine, we knew, like Tro, you know as well as I do, if
yeah,
you saw someone with tuberculosis, for instance, the doctors and nurses would go and the patient wasn't wearing a mask the whole time. It was us. We were the mask, and we went there to protect ourselves, right? So you start seeing this craziness of saying, wear 2 masks, wear 3 masks, wear 5 masks, put a visor and a ventilator on, and all this stuff. And then you go, how in the heck? I mean, those of us, we just ask the question, go, where do you get this 6 foot apart thing? Where's the data? Like, we
yeah.
like data. There was no data. Stand in a circle. Everyone had to be in their own pen. And you go, this doesn't make sense. I go to the airport with my family, but I can't sit next to them on the plane. You had to skip seats, and you go, it doesn't make any sense, right?
Insane. So much of it's complete insanity when you look back, and you just can't believe that this has happened. But I really understand. I understand exactly how it happens because I know that academic mindset, and I know that groupthink, and I also know, incidentally, look, I think people have forgotten how important and devastating the role of the lockdowns were in 2020, right? Not just because I'm not just talking about the destruction it reaped on the working class and small businesses and all of that stuff, but it was the fact that it was so welcomed by the very people who were pushing hardest for it. And I mean, and I'm going again, I'll say academics and politicians here. They actually had no skin in the game. They didn't lose anything by lockdowns. Actually, they did very well out of lockdowns. right? Because they were essentially, we're talking about the privileged elite with big homes and gardens. They had no understanding of the impact of lockdowns on ordinary workers and small businesses. They still expected like low-paid workers who stack supermarket shelves and deliver stuff to their doors. They still expected that to happen, but they were very happy in lockdown. I can't tell you how delighted academics, they had the time of their life during this. They were loving it. And not only were they loving it, what shocked me is that I was seeing all around me. In fact, I can probably even point to um, a couple of panels I was on that were with other academics in the early summer of 2020, where every one of the other academics on the panel was saying that the lockdowns are fantastic because they're helping the environment. They were saying, look at the decrease in carbon emissions. So there's no more planes flying. There's a 90% reduction in road traffic. It's fantastic. And they were saying things like, well, I always said it was clear. They were saying it was clear that they wanted the COVID lockdowns to be the precursor for climate lockdowns, and that's effectively what has happened with the move towards the UNWF Agenda 2030 and all that 15-minute cities. It's all about effectively climate lockdowns. That's what it's about, modeled on the COVID lockdowns, which they absolutely loved.
Yeah, I think, we don't react well under anger and under fear. So they put everyone under fear. So you just say, whatever they say, I'm going to do. They're helping me. So they're the good people. And you go, well, if you question it, Tro and I were called grandma killers because I go, wait a minute. If I walk into a restaurant and I'm standing up, I have to wear a mask. But if I sit down, I don't have to wear a mask. Like, is it altitude? Like, it made no sense at the time. But if you question it, you were the bad person. You go, wait.
Yeah.
Right? If I'm in my own car by myself, what do I have to wear a mask? Doesn't make sense. Like, none of it made sense. And hiking in the outside and you're out in the middle of wilderness, to close it down. You can't go out by yourself in the sun, because I just posted about today, not knowing we were having this conversation, but I said, if you want to kill someone, you put them in isolation, you take away their religion, you make them fear everyone around them, you make them drink more, you make them eat bad food, not exercise. I mean, it was a perfect storm to kill people.
Yeah, it was. Yeah. I mean, just thinking about some of the most bizarre things. I mean, the things I remember, things like of course, all the supermarkets were allowed to open, but they weren't allowed, for example, to sell non-essential goods. So you see these pictures because leading into Christmas, for example, that year that you got these kids looking longingly at the toy section, which has been blocked off, and they're not allowed to enter it. I mean, it's just
wow.
It's nuts.
Yeah, it's amazing. Now you had to be like all alone. Like, did you have other people who thought like you and said, wait a minute?
I had a couple of colleagues, Martin Neal, the co-author of my book, and also another colleague, Scott McLaughlin. And we sort of I actually made a lot of good new friends. We had a sort of small group. I got in touch with people like Jessica Rose at the time, Jonathan Engler, Claire Craig, a lot of good people. I mean, I met people like Malone as well, came over to the UK, Ryan Cole. I mean, so I got to meet people who were challenging the narrative, and some of those friendships have been enduring, and we still work together in
Ivor Cummins. You must have crossed paths with Ivor Cummins.
Yeah, no. Yeah. Although I think it's a complete. I don't know if I can mention. I'll say it. I'm not scared to say it. I have actually fallen out with a lot of those people since October the 7th because I'm Jewish and most of my family. Family come from Israel. A lot of my family are in Israel, and I found that a lot of those people turned out to be anti-Semitic conspiracy theorists. A bit strange. I found that strange that, in particular, the people who are alert and awake to the lies being told by the mainstream media, whether it's the New York, by the UN, the WF, all the globalist organizations, and then you get the New York Times the Guardian, the BBC, CNN. These were the people who were pushing the lies about COVID and the vaccines. And they saw through all that, but somehow they believed everything those people were saying about Israel and Gaza. So that was
It's
everyone.
amazing. It's amazing how that is. We see the same thing and we have different views of that.
Yeah.
There's something called hyper reality where you see something or you hear it so many times. Like, how many times do we hear the vaccine saved 20 million lives? Like, you hear that, you go, what are you basing that on? Just some flawed model. Like, in reality, what are we saying?
Yeah, we debunked that particular one as well quite extensively. I mean, that was just, that was an incredible example. I mean, I'm happy to go on to talk about the whole thing about how the vaccines. I mean, one of the big things that we did with the vaccine stuff is we knew very early on that there was a problem with the vaccines. That there were two reasons why I was particularly attuned to this. For a start, the clinical people who I'd got to know during in 2020 during the sort of the lockdown and that hysteria, I was getting information from them about problems with the lack of testing of, and the ridiculous speed at which they were trying to produce this novel mRNA technology, etc. So I was already getting some insights from clinicians, right? And so we wanted to look at the early data on the actual real data. We knew there were problems with the Pfizer study. We knew that was garbage, but we wanted to look at we were fortunate enough in the UK actually to have pretty reasonable data initially coming out of the Office for National Statistics on the mortality by vaccination status. This to me was always the crucial thing. If you want to know whether a vaccine is safe and effective, and in particular you want to know it's safe, is the overall all-cause mortality of those who are vaccinated lower than the all-cause mortality of those who are unvaccinated? Because let's face it, if the vaccine is safe, and effective, then fewer people who get it are going to either get COVID and die from COVID. And if it's safe also, then they're not going to die from side effects of it, right? So overall, the balance should be that more people are going to be saved than die from having a vaccine. That's what you're looking for. That's why we looked at this all-cause mortality. And we were only interested in that.
Are you talking about the old definition of vaccine or when they changed the definition?
Yeah, we're talking about
Right.
we're talking about the definition. We looked at the data. The ONS was publishing very early on from January. Actually, we got early data, January 2021, when the rollout first happened. We were looking at the numbers of deaths. They were publishing the number of deaths classified by vaccinated and unvaccinated. Now there were problems with it because it was age confounded. We tried to take all that into account, but we saw an unmistakable early safety message, right? And it was the fact that in each of the major age groups, we were seeing a peak in non-COVID deaths at the time when the vaccine rollout was peaking for that particular age group. And this didn't make sense. This didn't make sense to us. Why would people who are not vaccinated suddenly die of non-COVID at the time when that particular age group, most of them are getting vaccinated? Didn't make sense. The ONS were basically trying to claim that though the peaks in those people dying, that was the unvaccinated. But just, again, this didn't make sense. And to cut a long story short, we did extensive analysis, and the only explanation for this was that they were actually classifying those people. We knew, in fact, they were. This is another thing. People who died shortly after vaccination were being classified as unvaccinated because, according to the definition, you're not considered to be classified until at least 21 days after the first vaccine. And you're not considered then also, it goes on, to be double vaccinated until at least 21 days after the second vaccine, etc.
So if you died, if you got hit by a car or anything like that,
So
you were unvaccinated.
all the people who are dying shortly after getting vaccinated, which we knew also, we had real evidence, anecdotal and real evidence, that there were a lot of when the old people in that January, February period, they were vaccinated everyone. And people who say, hang on a sec, people who were close to death or people who had major morbidities, they weren't given the vaccine. It's not true. They were the ones prioritized for the vaccine in the UK.
Mm-hmm.
Right? They were going into care homes and vaccinating those who would normally considered to be the most at risk. But these are the people who were likely to die within a few months anyway. What it was basically doing, the vaccines were bringing those deaths early.
Yeah, hospice patients were given the vax and dying. Well, they already had a hospice diagnosis, and then they died, and they go, COVID death.
And so
right?
they're classifying those as unvaccinated deaths.
Yeah, exactly. If they died within
The
21
other thing
days.
about is that definition. By defining someone as unvaccinated until at least 2 weeks, in the UK it was 3 weeks after the first vaccination.
Because then you lose all the vax deaths. If you're going to die of the vax injury, have an acute response.
When you're moving now to effectiveness rather than safety, you're trying to determine, is the vaccine preventing COVID cases in greater number than those who are unvaccinated? And where you get these 95%, it's 95% effective in stopping people getting COVID. That was all based on a pure statistical, and something that we've demonstrated extensively. It was a straight statistical phenomena whereby you'll always see this, even if you give everybody the same thing, even if you give everybody a placebo instead of a vaccine. So just think of that. So it has no effect whatsoever. If you count people getting whatever it is you're supposed to be vaccinating against within the first 2 weeks of having the vaccine, if you're counting those as unvaccinated, then it's inevitable that you're going to get this appearance, this high efficacy, starting with this high efficacy, apparently, of people being vaccinated. Because the only people who are getting the only cases you're recording are those of people who haven't been vaccinated. You're missing all the ones who've been vaccinated. So that's how you get this. It's a statistical illusion. We call it the cheap trick. And we documented this extensively. And we showed that you can not only simulate the actual numbers that you were seeing, but we know from the actual studies that were claiming this, that this was why you were seeing it. It was simply because of this definition of who was vaccinated, and who was unvaccinated. And so
did people in public health not know that, or did they not want to know that?
Oh, I mean, this has been, they tried to create all these excuses to why it didn't apply to their studies. And every single study, we did a systemic study of the 30, it was something like close to 40 of the most prestigious randomized controlled trials. Sorry, not randomized, the observational trials or randomized controlled trials that had happened once the vaccine had been rolled out. And in all but 3 of them, this cheap trick had been applied and was basically completely biasing the data.
Tro, you jump in, man. Tro's been blood vessels are popping out.
Questions. Yeah. So one is, people eager to take a vaccine are usually at least under the impression that they're more sick. So I know that there's some controlling of those confounders that have to have.
Yeah, this was the so-called healthy vaccinee effect. They were trying to say, our results are flawed because you're not taking account of the healthy vaccinee effect. But that's rubbish. We did.
I'm just sort of saying all the ideas that come to my head. You can explain if it's rubbish or not. Then the other thought I had is, one of the things I'd love to see with these, studies is, if somebody's taking a vaccine, a novel vaccine, certainly, there's no benefit within the first week, right? Like there should be no, antibody production, right? Within that first week.
And that's the justification. That's the justification they were using they were saying it was not a 1 week, they were using a 3 week period in the UK. They were saying, well, you shouldn't be classified, even though you've had the vaccine, it doesn't take effect. Therefore, you shouldn't be classified as vaccinated within that period.
They shouldn't classify it for efficacy. They certainly classify it for safety, right? So it should go the other way
Exactly.
around.
But
Right?
even for efficacy, you see, the problem is they're saying you shouldn't, it's not counted for efficacy.
Yeah.
They're saying because, you've got to give it time to take effect. But what they were doing, and here's the critical point, what they were doing was if those people within the first 21 days of vaccination, they're classified as unvaccinated, if they were PCR positive, then they were counting that as an unvaccinated PCR positive. And that's where you get the statistical illusion and the cheap trick.
Yeah, they can't do that. You have to back out the upside in that
Exactly.
period
You think
and
it's
maintain the
obvious?
downside because the safety downside is real, right? So
Yeah, but they weren't doing that. They had in the UK the way the reason you think if it was a controlled experimental, if it was a randomized controlled trial, you can do that. You can just ignore those, right? But they weren't. They were counting them in the bucket of vaccinated. And the reason they were doing that is because they were using different data sets on the number of people who've been vaccinated and the number of cases. They were completely different data sets. So they'd say, okay, well, this week, here's the number who've been vaccinated, here's the number who are not vaccinated. Let's look at now the data set of how many COVID cases we've got. And that's where the COVID cases of these who've been vaccinated in 21 days were counted as unvaccinated COVID cases.
I think I'm curious, when you look back at this point where nobody's taking the COVID vaccine, has that all-cause mortality data changed?
Yeah. So of course, what happened, of course, was that eventually the ONS kind of owned up to these errors, to be fair. But they tried to do things right. But what happened was that it was what we were seeing. They were still doing misclassification, and they still weren't taking account of the healthy vaccinee effect. And if you took account of all these confounders, it was absolutely clear by May of 2023, which was essentially the last time they published the data. It was absolutely clear by then that there were noticeable differences in the all-cause mortality in most of the age categories. There was a slightly higher all-cause mortality in the vaccinated rather than the unvaccinated, but it was narrowing. It was narrowing, and at which point, anyway, they stopped publishing the data because they said, "Well, we know the vaccines are effective. We don't need to publish this data anymore."
So the other big question that arose when you were talking earlier too was you said in Ireland no one under the age of 38 died of COVID,
Yeah,
and now they want to give it to newborns, and they're justifying that. How in the heck can they possibly justify when they look and they go, look, mortality is zero? The risk, then there's no risk. I mean, it's all risk and no benefit at that point.
Look, there was never any risk of COVID to people who, I mean, I don't believe there was any risk other than the normal kind of, COVID, whether how novel it was, whatever it is, it's a nasty flu type virus, right? And the elderly, and people with serious comorbidities, we know, can be at serious risk of even death with that type of. We know that, okay, fine, but nobody without any serious comorbidities or no healthy person was ever at real danger of dying from COVID. And if you hear when you hear these stories of people who apparently, I know my cousin or my nephew my neighbor's uncle, was the healthiest man you've ever seen, and he dropped dead with COVID within 2 days. No, when you go into these stories, there's always something more to it.
Mhm. What was your first red flag where you go, something's wrong? Like, just as a mathematician looking at it, what was your first, like, just the reaction, the global, like, for me, I was like, everywhere in the world's reacting the same exact way. That's unusual. That's
Oh, well, there was that. There was that. I didn't. I mean, there was the first was when they were claiming the 4%, 4 or 5% infection fatality rate. We knew we knew from the data, even if you looked at the data, from that, what was it, the Princess, that cruise ship,
yeah, Princess Cruise Ship.
read
Yeah.
data from Japan. We had data where we knew we did the proper Bayesian analysis of that, and we independently and Stentley of Ioannidis, who came out with a similar number, we published.
Mhm.
This is at a time when we weren't being yet censored, actually. Um,
That's when he was called a fringe epidemiologist, right? The most
we
published guy.
showing that was massively exaggerated, that infection fatality rate. But at that point, we weren't aware of how flawed the PCR test was. It was only then later when I started to realize and the implications for the case numbers that they were claiming in early summer and late summer, whatever, that I realized that they were completely flawed because they hadn't taken account of the inaccuracy of the PCR testing.
Yeah, and that it was funny, Tro, because way back in the day, I questioned. I said, "Look, I'm testing people, and I'll tell you, I met with a major manufacturer because I go, look, I'm on a college campus. I want to be able to be able to pick this up early, right? And so this is before we knew how bad the testing was, but I had people test positive, negative, positive, negative. It was like I could have just flipped a coin, I would have been more accurate, right? And so I said, well, if someone comes to the classroom and they go home that night, start coughing and feeling bad, can I test all the other people that were around them that day? And they go, oh yeah, you could test all of them. And I said, well, is it clinically significant? I mean, is it going to help me? If you got exposed today, it's not going to test positive today. And she goes, doctor, you realize you get paid for every test you do, right?
Yeah.
Right. And you go, geez. And you see how it is. It was like that. They're saying just test everyone because you get paid to test people.
Oh, I mean, absolutely. Incidentally, I mean, in the UK, they introduced this sort of ridiculous track and trace program, which
Yeah.
was, if you went, which included, not only did it include the unnecessary sort of false testing and stuff like that, but it was, they also tried to introduce a digital, an app for the phones, which was a complete disaster. Okay, but it was costed at full that cost in the space of a year, £40 billion, the track and trace program, this unnecessary program, because of course everybody's getting all of these people, friends of government officials, were getting paid millions to do this stuff. £40 billion. There is no evidence it saved a single life.
Did you
No
get
evidence
paid?
can be
Did you get
provided.
paid for telling people, to eat real food and healthy, go to church, pray with each other, exercise, get sunlight? Did you get paid by anybody? Did
No,
Gavin Newsom give you a paycheck?
no. It's incredible,
Yeah,
isn't it?
it's incredible. The only country that I saw during COVID was El
Sweden.
Salvador. El Salvador saying exercise, drink water, get out in the sun, be active, enjoy life, eat real food. That's what they were saying, the same thing, Tro. In El Salvador, the only country in the world that I saw that got it. And then the other big one for me was when we raised the idea of, like, if I already have it, why should I get the vaccine if I've already had it? Natural immunity. And they said that's a right-wing conspiracy. There's no such thing
Yeah,
as natural. Like, we've known about that for hundreds of years. Now all of a sudden it's a conspiracy theory.
I know, it's incredible.
And
The
how
other,
about
the
the
other,
Israel data? The Israel data was what I was watching, and I was like, they're not getting any better. They're getting worse.
I know, so many places the data was well, we know it massively increased. Australia didn't have any cases until they introduced the vaccine.
Wow. It just,
So,
the whole thing is so wild. It's like, the thing I keep thinking is, if we talked about this 2 years ago, we'd be thrown in jail, like black
yeah, all of
bart,
this.
lose your
I mean,
medical
this is why
license.
I got, I was basically forced, I should tell you because I'm conscious that we've been almost over an hour, so I'm just conscious that I want to say what I wanted to say about my personal
Yes,
uh,
please.
interest in this, because this relates to it. So the in the UK, we had not just the Pfizer and Moderna vaccines, but we were heavily pushed to have the people heavily pushed initially to have the AstraZeneca vaccine, which incidentally, I don't know if you're aware, it never got authorized in the States.
Mm-hmm.
This, even though that was it was even though it was in the States that was the mass producing it, and we write about this in the book, and there was all kinds of problems with the production of that stuff in the States, but it was never authorized for use in the States, right? But it was used extensively in the UK, Canada, and elsewhere. And this was kind of like a big thing in the UK because it had been developed by a team mainly at Oxford University under the leadership of a lady called Sarah Gilbert. And they had this in January. So when of course, this was the first vaccine that was being given. Incidentally, I mentioned about we were looking at the early data from the ONS, but anecdotally, I knew there was a problem with this. A person I actually know very well, his father was old, but uh, not unhealthy, was given the vaccine either on uh, New Year's Eve of 2020 or New Year's Day of 2021 and was dead within 24 hours. And of course, the family said, "Oh no, it was just pure coincidence, nothing to do with the vaccine. If you're going to go, you're going to go, nothing to do with the vaccine." So I knew there was that sort of I knew about the problems. It was obvious, and I knew how people would react to it as well. I knew this would be completely covered up. But they were pushing. I don't know if you've seen this. There's a very, very famous clip of these doctors, TV doctors, talking about how the AstraZeneca vaccine was proved to be 100% safe and effective.
Mm-hmm. Yeah, we've seen that.
Right,
Yeah,
100%
100% effective, 100%
yeah.
safe.
And the AstraZeneca vaccine even was actually known, even by the end of January, to have caused actual deaths in the UK. Right, which were actually, I mean, there are not that many deaths in the UK which are coroner certified as vaccine deaths, but there were even within that early period, there were. And in fact, it was known there was a known problem with the blood clots factor. I know, even though it's not official, that the AstraZeneca was actually removed, was no longer being given in the UK as early as late May 2021. It wasn't officially withdrawn until 2 years or 2 or 3 years later, actually. But no, it wasn't, as I know from the GPs, and of course, obviously done extensive research, as I know that GPs were no longer being given it. And you had to like make some special request if you really wanted it. And even then it was difficult to get hold of. But the most EU countries openly suspended the AstraZeneca vaccine by April of 2021. Now, my wife, my wife had already been diagnosed with dementia, a rare type of dementia, frontal temporal dementia. She had been diagnosed over 2 years before this, but her condition was quite stable. It was sufficiently stable. She was still driving. She was sufficiently cognizant to know that she wanted to go and visit her family after all the lockdowns. Finally, she had the opportunity to visit her family who live in Israel. And in March of 2021, finally, for the first time in a year, it was possible to travel and to enter Israel if you were fully vaccinated. So against my wishes, she got 2 doses of the AstraZeneca vaccine in March of 2021. And her condition rapidly deteriorated shortly after that. And I believe that, of course, it was never something that I might make public at the time. And, I was not prepared. I didn't want to. In the UK, the only recourse you can have is to basically sort of sue the doctor. Well, my GP, I was very friendly with them. They'll never go down that road. And in any case, nobody gets, it's almost impossible to prove vaccine injury in the UK, and almost nobody's got compensation. There have been very few, as say, coroner reported deaths, and if it's not a death, you're obviously not going to get any extensive investigation into the condition anyway. But I believe that happened. And an anecdote on this is that on the 28th of June 2021, Sarah Gilbert, who by this time had actually been given a damehood, so she was now Dame Sarah Gilbert for her work on the AstraZeneca vaccine, was given a standing ovation at Wimbledon, Centre Court of Wimbledon, even though, unbeknown to most people, the vaccine had already been withdrawn as too dangerous 2 months prior to that. I mean, this is the sick world. This is what we were living through. I mean, it's just beyond belief.
Yeah. Two questions I have, and you mentioned, first of all, I'm sorry about your mom, and that's devastating.
His wife.
My wife.
Oh my God, I'm
she's
sorry.
she's now permanently in a care home and has no cognitive ability, has no mobility, requires 2 full-time carers.
I am so sorry, Norman.
Just to get from a bed to
I can't even imagine the devastation.
Oh yeah, it's personally devastating. Yeah.
I have so many questions that seem cheap in response to what you just told me. But you're the world's expert in stats, so I have to ask them. I remember Israel had a very strong campaign to vaccinate the population.
Yeah.
And I'm wondering if you've ever had a chance to look at the data in terms of the number of vaccinations.
Oh my God.
And if there's any mortality data there in terms of increasing vaccinations, increasing mortality, or if we can make any conclusions from it. Because I remember
it's very difficult.
The vaccination rate there was very high, and it was just maybe the Orthodox population that did not vaccinate.
Well, it's interesting. It's not just, funny enough, people think of it because of, all that stuff about, Bibi Netanyahu claiming that they were happy to be the sort of the lab for Pfizer and all that sort of thing. People assume that Israel was the most highly vaccinated population. Actually, it's actually relatively low now for the simple reason that the Orthodox Jews and the Muslims tended to not trust the government and tend to not get vaccinated. So actually, I think even at the peak, they never went much above 70% of the adult population, whereas in the UK, the claim was that it was 95%. We don't believe it was anything like that, which is another thing. They were exaggerating how many people in the end got vaccinated, but it wasn't that high. And there's a whole chapter in the book about our battles with the scientists who worked on the Israeli study on vaccine effectiveness and safety as well. We exposed, in fact, the first major observational study on the Pfizer vaccine was a study published in The Lancet in May 2021 based on the Israel population, because at that time, that was the best data because they'd been first to kind of like mass populate. But not just that, they had very, very good, they had these extensive medical, they had a very good medical records system for recording, the vaccinated and unvaccinated and those who were testing positive or not. And they were claiming that it was a big splash. Oh, that this study has shown that in practice, the vaccine is 95% effective. And that was backing up the 95% Pfizer effectiveness figure that was quoted for the randomized controlled trial, of course. So it was acting like a confirmation. This is the ultimate validation over an entire population. It's safe and it's effective. Well, not safe. They weren't claiming safe then because they didn't have the adverse reaction data, but they're claiming it was safe. Now, the point is, we exposed the flaws in that study, and we put an immediate response to the Lancet, which is the sort of most prestigious paper. I won't go into details, but it was completely flawed, that study. There was no way that 95% effective claim was valid, right? For many reasons, right? Including the fact they weren't taking account of the fact that the unvaccinated were 6 times more likely to have a test, a COVID test, than those who were vaccinated. But stuff like that. Anyway, there were all kinds of other reasons.
Oh, yeah, there's a lot of confounders like that. Yeah, because if you weren't vaccinated, you had to get tested multiple times. You got vaccinated, you can't get it. And that was another problem, is I was seeing people who got vaccinated who got COVID, and they go, I can't get it. So they're coughing on all their classmates, right?
But the point is, we put in an immediate response to the Lancet, which they sat on and didn't reply. They said they said they wouldn't publish it until they had a response from the authors. The lead author, who was a woman who was effectively who was the liaison person for Pfizer. She worked for the Ministry of Health in Israel, but she was effectively the liaison person for Pfizer. So there was a massive conflict of interest, which we also pointed out. And it was not until we put that in May 2021, we finally got a response in January 2023, I kid you not, saying that because they never got a response from that lead author, they weren't going to publish our reply. And I put that on X straight away, and it got 1 million views within 24 hours. And because of that, the Lancet then wrote to me and said, well, actually, we've rethought it. We will actually publish a revised version of your letter now. And so we quickly we got together a revised letter, just added some updates to it, sent it back to them within 24 hours. And then they said, well, actually, we decided not to publish it after all. And there's a whole chapters about this and all the freedom of information, subject access requests, and we had the editors of the Lancet were saying things like, well, we can't publish this because these guys are known to be anti-vaxxers and conspiracy theorists.
No matter what the data shows. It's
so
frustrating.
What the data showed, they were focusing on us and deciding that we weren't sufficiently worthy people to be offering comment on this because we were known to be anti-vaxxers, which was complete nonsense. I've never commented on vaccination in my life before looking at the data on the COVID vaccines.
And it's such a hard thing because there was such a willful blindness, it still goes on today. I have doctors I take care of because they were the first ones to get it, and they had bilateral pulmonary embolism, stroke, heart attack, myocarditis, and they go, no, it's not from that. I go, it was 3 days after you got your shot. And they go, no, it was just coincidence. They can't fathom. They just cannot. So I saw multiple nurses with DVTs. One of my patients was like 88 years old, still active, got bilateral pulmonary embolism, DVT, and they go, it was a congenital clotting disorder. I go, no one in her family had a blood clot. She's 90 years old and she's walking and mobile, and and so I asked the nurse, how many have you seen in your facility? She goes, oh, a lot. Like in 20 years, she saw like 2 cases. Now she sees like 20 in a year. And you go, that's what's the odds, but that this correlation is not causation, they say. And so, people developing autoimmune diseases, cancers, recurrence of cancer after 20 years, all this stuff. And you see it and you go, how can this possibly be?
One thing I should say, it might be the last point I can make, so I probably need to go.
Thank you so much for your time, Professor. This is very, very enlightening.
One point I will make is because it goes back to, you asked me about the all-cause mortality and were we seeing significant increase. And as I said, no. Because of the obfuscation of the data, I don't believe those people amongst those who had challenged narrative, those who claimed that the we know the rubbish about the vaccine saving 20 million lives, right? But unfortunately, there are also people who claim that the vaccines have caused 20 million deaths. And I don't believe that the data shows that, partly because it's very difficult to get the real data, the relevant data to do the proper all-cause mortality calculations. What I believe is that there is evidence that deaths have been brought forward, and therefore over a period of you wouldn't be even seeing millions of increased all-cause mortality over relatively short periods because of this, right? But what you're seeing again is these increases in cancer. All of these things are there, but that doesn't necessarily lead straight away to demonstrable proof of massively significant increases in all-cause death.
How about
So
the data
make
released
that
by
point.
Japan, South Korea? Are those studies relevant?
Yeah, because they're showing genuinely increased incidence of, for example, cancers amongst the vaccinated.
And how about Edward Dowd? I don't know if you follow him.
Yeah, I think he was
Statistician.
making. That's the kind of claim that I'm much more uneasy about, I have to say.
Yeah, that's why I was curious because you don't know how much. You're right on both sides. I think it's being dispassionate, going, what is the data? What's the data? What are we seeing? Not what these extravagant. This I use a model that predicts all these things, and so that's what's really important. But Dowd was saying if you looked at the difference in all-cause mortality from the unemployed to the employed, there was a huge uptick in the employed. I don't know if that's correct, but that's what he goes. It's impossible to see these numbers.
Yeah. Anyway, that's it. Yeah, so that was sort of my final word, I guess.
Professor, thank you so much.
Thank you so much.
Thank you so much. We really greatly appreciate you coming out and for dispassionately explaining the numbers and looking at this stuff, because it's still such a hot topic. And, again, we couldn't have talked about this a couple of years ago, even though we were seeing what we were seeing, and it was so frustrating that we couldn't get the word out. So we appreciate you coming and saying, what are the actual numbers and what are the confounders? Tro?
Yeah. Great to speak to you anyway.
I appreciate you coming on and sort of sharing your insight and, making, gut checking the fact that Brian and I aren't crazy, and
not on this, at
we're
least.
on the right track.
Good to speak with you. Yeah. Okay.
All right. Bless you, Professor. Thank you.
Night.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.